Welcome to our look back at 2018-19. We continue on our journey to transform how we work in Barnsley and develop our workforce so people experience seamless care and get support from the right team first time. We have invested in supporting people to live well with a long-term condition, in young people's mental health and well-being, and raising awareness of the signs and symptoms of cancer. Here's a few of the highlights this year. Getting an early diagnosis of cancer can make a huge difference to the success of your treatment. We invested in Be Cancer Safe this year, and now over 3,000 Barnsley people have signed up to be a cancer champion. Here's Ian and Catherine to tell us more.
Be Cancer Safe in Barnsley, it's been running for just over a year now. We started in April last year. So last year we recruited 2,600 champions, and this year from April we're currently running about 700. So the purpose of the project is to raise awareness about the importance of the early detections of cancers. So we go out into the community and we talk to coffee mornings, church groups, businesses, and basically it's to let people know about what screening's available to them for cervical cancer, breast cancer and bowel cancer, and also what the screening ages are.
Anyone can be a cancer champion. Cancer champions will go out and they will explain our message to a wider population. Going home, talking to their husband, their wife, their brother, their sister, and that's all those cancer champions are doing, is they're encouraging people to be proactive in their healthcare and really look after themselves.
We have expanded the teams who work as part of your GP practices. After a successful trial during the busy winter, we have introduced additional advanced clinical practitioners who work alongside your GP and can carry out home visits during the day. Here's Vicky to explain how it works.
So I work on the home visiting service, doing home visits for GPs. So what that entails is the GPs making referrals to iHeart, and then myself and a group of other practitioners going out and carrying out those home visits. So the visits that we tend to see tend to be kind of more urgent, acute stuff, if you will, rather than the more routine, ongoing care that the GPs still manage. So the reason Barnsley Healthcare System set up the iHeart home visiting team was to make sure that patients of Barnsley get seen in a more timely fashion. The advantage of the home visiting service, the way that it works here in Barnsley, is that we obviously go out and see them throughout the day, and then therefore those patients that do need admitting get admitted quicker, but also it means that there's more people that avoid sort of going to hospital because we see them sooner than perhaps they might have done using a more traditional GP model.
Last year we asked South Yorkshire Eating Disorders Association to run education sessions on eating disorders and emotional resilience to Year 6 children in Barnsley primary schools. Following the success of these sessions, the team went on to trial an eating disorder counselling service in some local secondary schools. Here's Hannah to tell us more.
Saida works with people who are experiencing mild to moderate eating difficulties. And the work that we are currently and have been doing in Barnsley is to try and work with young people either at the beginning of their difficulties with eating or even potentially before that. A lot of the research around working with people with eating disorders is that early intervention is the key, because once an eating disorder is established, it's much more difficult to undo those behaviours, whereas if you can catch it really early on, the behaviours are more easily undone.
Last year we introduced a range of exercise and weight management services for people to help them get fit before possible surgery. Here's Martin, who has arthritis in both knees and went to his GP thinking surgery was his only option.
3rd of January, I've just done the local cinema. I'm just walking across the car park. I could walk no more. So I had to ask 2 people over at distance if I could borrow the walking sticks. Anyway, the upshot was I got stage 4 arthritis, both knees. My BMI was 32.7. I was absolutely devastated. So it said, unfortunately, we are unable to do an operation. However, you can have a referral via the NHS for 12 weeks. That be either to Barnsley Premier Leisure, Slimming World or Weight Watchers. I thought that probably Barnsley Premier Leisure would be the best place to go, and as it turned out, yes it was. But I then realised that doing that exercise just on exercise wasn't enough. I needed to control what I was taking in my mouth. So I decided that the next thing was Slimming World. So signed up at Slimming World, and obviously with Claire's help I've now got to where I am today. Also, the ultimate thing is now I don't need no operation, because through losing the weight it has meant that I'm in no pain anymore, and I take no painkillers whatsoever, and I just enjoy life. So yeah, absolutely brilliant.
People have been getting involved this year as they tell us what they want the new NHS long-term plan to focus on locally. Young people's mental health and well-being has been a big focus for us, so it was great to see the Oasis Young Commissioners from Barnsley talking directly to the national leaders of the NHS about what they wanted to see in the long-term plan.
So when we went to London for Youth Voice Summit, we went as a group with Chili Pepper, and we did it was to do with like green paper and feeding into the NHS long-term plan. When we as a group looked at the long-term plan and broke it down into certain points, so like across all different aspects, we looked at more the mental health ones, and a big one to do with us as young people, we thought about transition and that transition period between like CAMS and adult services. We also got to meet Simon Stevens, which was really good because he answered a lot of our questions and we could freely ask him questions. They really took what we thought into consideration, and it were really good.
Last year we invested in an internationally recognised education course for people living with diabetes. A year on, over 100 people with type 1 diabetes have benefited from these courses. Here's what they had to say.
I was diagnosed with type 1 diabetes on the 18th of October 2017, and I began the week-long Daphne programme at the beginning of February of this year.
I've been diabetic 28 years. I became involved in the Daphne programme on the 9th of February this year.
Daphne stands for Dose Adjustment for Normal Eating, so basically teaching type 1 diabetics to adjust their insulin based on what they're eating.
It's really important that diabetics learn about the condition, learn how to manage it. It's good to get in a group of diabetics. I've never had that.
There were people on my course that had diabetes for 25 plus years whose ideas of their condition were completely changed in 1 week.
Made me realise that testing my blood sugar was a key factor of getting it all right and getting it all there and controlling it.
With Daphne, you're able to help yourself rather than relying on somebody else. I can take back control that I lost.
It's beneficial to any type 1 diabetic. I'd recommend it to anybody.
We are proud that Barnsley CCG achieved all of our financial duties in 2018-19, so let's have a quick look at the way the CCG's budget was spent. The CCG's budget for 2018-19 was £423,650,000. If the budget was represented as £1, here's how it would be broken down across the services that we fund. Hospitals and transport, 50p. Prescribing, 11p. Primary care, 11p. Community, 11p. Mental health, 8p. Continuing healthcare, 5p. Running costs, 1p. And other programme costs, 3p. Here's a look at how we spent with our biggest providers. Barnsley Hospital, £158.4 million. South West Yorkshire Partnership NHS Foundation Trust, £60.4 million. Sheffield Teaching Hospitals, £24.6 million. Yorkshire Ambulance Service, £9.8 million. Rotherham Hospital, £5.2 million. And Doncaster and Bassetlaw Hospitals, £5 million. Barnsley Hospital has been on our TVs this year. Viewers tuned in for a glimpse into the lives of people coming into accident and emergency and got to know the staff and volunteers across the hospital who care for them. Away from the TV screens, This care and teamwork means that Barnsley Hospital has consistently met the national target for treating or admitting over 95% of patients within 4 hours of their arrival at A&E, leading the way across the country. Throughout the rest of the hospital, a team has been established with the expertise and the focus on the flow of patients as they receive their care. They ensure everything is coordinated for people to get the right care at the right time in the right place. Next we go on a trip to the Dearne, where health and wellbeing teams are being transformed. Health teams, the council, community and voluntary organisations and local residents have all been trialling a different way of working together as one. Here's some of the team to tell us how it's been going so far.
Integrated care is about fetching health and social care providers together in order to work more effectively.
In July 2018, the Integrated Care Partnership launched a proof of concept in the Dearne, and that was to test new ways of working at a locality level.
The Dearne actually has got some of the highest levels of deprivation across the Barnsley geographical footprint, and it's got some particular issues in that the Dearne as an area really is almost 3 distinct communities, and that in itself is quite challenging, particularly for delivery of care.
We put together an integrated task group, so there's people there from the CCG, from SWIFT, NHS, Area Council, Barnsley Council, schools, children's services. What we do is look at 2 priorities, young people and emotional well-being.
It's about looking at some key examples and case studies about what people's experiences have been, what's worked well, but also what haven't we done so well, and can we address some of the challenges going forward.
I'm a community matron. I work with patients who live around the Dearne area who've got complex or multiple healthcare needs. With integrated care teamwork, I've learnt to link in better with the other services that perhaps ran parallel to that patient previously. Now I work with a wider group of people to give better patient care.
Integrated care benefits patients from linking up and making it such a smoother process. I work very closely with Salvation Army and I also co-locate here regularly. I refer people to these whenever I need, it's just a phone call. They are able to offer food parcels for anyone in the community that's in crisis. They run social groups for people that are socially isolated. Integrated care has such a positive effect on relationships with mental health in Dearne, and that's had a huge effect on patients we see.
As we know, primary care and GP services are all under a lot of pressure. So we need to find ways to think how we're going to work together. I have referred some of my patients to the social prescribing team, and they've gone into their houses and have helped patients. All this means we can work together, so one team, rather than having to work as separate teams and having patients having to repeat themselves several times. I hope the integrated care is a way forward for future patients' experience and patients' care.
Integrated care is extremely important. It's bringing services together in a way that they never worked before. It doesn't matter which organisation you work for. Talk across the table in an honest and truthful manner, and that is the way things will change.
The energy that we've got in the Dearne to actually improve things is fantastic. My message to the other 5 neighbourhoods is get involved. The time that you invest in this is absolutely critical, and the outcomes that we're starting to show in the Dearne might be soft at the minute, but they'll lead on to actually real outcomes.
Getting the right people involved early on is be really helpful. The conversation will happen quicker and you'll get to the solutions quicker.
Ultimately, it's about how our residents benefit. The hope for the future is that we can actually engage with everybody across Barnsley.
It's a supportive, really positive, inspirational group that we've got, and I think if you get the right leaders round the table in the other areas, it can be just so.
This year, the NHS introduced primary care networks as part of the NHS long-term plan. Here's Dr. David Shutt from Barnsley Healthcare Federation to tell us more.
We know that as medicine is advancing, people's health needs change and society develops. The NHS has to continually move forward so that in 10 years' time we have services fit for the future. This year, the NHS long-term plan was published, which will help us do just that. Something called primary care networks were part of that plan. This is where groups of GP practices are contracted to be part of a network where they will be working together much more closely, helping them to respond to the needs of their local communities. That's a new thing for many areas of the country, but GP practices in Barnsley have been working towards locality focus and greater integration with other services for a while. The primary care networks will be the building blocks for how we can offer more seamless care and expand the traditional team you might see in your GP practice. We've already successfully added new additional roles into primary care, such as clinical pharmacists, and over the next 5 years we are looking to add physicians associates, first contact musculoskeletal practitioners and paramedics. We've developed 6 neighbourhood networks across the borough, which are very similar to the local authority's area council areas. It's very early days for these networks of GP practices, but we're already starting to see some exciting opportunities ahead. We're working very closely with the community health services and expanding on the great examples we've already seen in the Dearne Valley.
Thank you for taking a trip through 2018-19 with us. We are proud to be rated as an outstanding CCG for the 2nd year running, and together with our staff and partners, we have been recognised for our innovative work putting Barnsley on the map.
I don't know, you were doing really well there.
I felt like I was
there. This year the NHS long-term plan was published, which will help us just do that. Do just that, isn't it? Yeah, I did that yesterday as well. I'll start again.
This is Jenny, and Jenny's one of the local councillors for this area.
Yes, I feel better. Okay, thank you.